Kenya's healthcare system is undergoing a major transformation. At the Health Summit, Deputy President Kithure Kindiki delivered a powerful message about the government's vision for a stronger, more accessible, and more reliable healthcare system for every Kenyan. He highlighted the progress being made, the challenges that still remain, and the importance of continued commitment to improving healthcare across the country. So, what does this transformation mean for ordinary Kenyans? In this video, we take a closer look at the key points from his powerful speech and what they could mean for the future of healthcare in Kenya. Let's get into it.
We've traveled quite a journey, and I would also say the same about you. And the evidence is there to be seen, what you have done with the colleagues at the Ministry of Health to stabilize this very important sector. We needed a steady hand to help us navigate the issues in the health sector. Makofi kwa waziri wetu. Brothers and sisters, I think I've been asked to do two things. The first one I'll do now, then I'll sit down, listen to the high-level panelists that are going to help us navigate the issues, the three issues that the minister has spoken about, and the PS. And after the panelists are done, I'll come back for a less than 10-minute summary of yesterday and today. How you are able to condense 2 days program in 10 minutes, only Duale knows, because that is the assignment he has given me. But I'll try my best to do that. So allow me first just to set the stage for our panelists by saying the following, that His Excellency the President yesterday, in the morning and in the evening in the town hall, set out the direction of our national health reforms and the progress that we have made together as national government and county governments working in concert. The President's overview that he gave us yesterday. I have been asked to focus on execution, on what must happen for the reforms in this sector to deliver consistently to the people of Kenya. And for that purpose, I invite you to consider a simple delivery equation, which is the right health workers, the equipment, which have the right products and technologies, and also delivery of the right services at the right time. Effective implementation requires a coordinated approach. I don't want to overemphasize the need for coordination. And I want to salute our brothers and sisters in the Council of Governors. Governor Abdullahi, the chairperson, and your team, we are very, very blessed to have this cohort among the Council of Governors. Between you and your predecessor, Governor Waigoro, the former chairperson, you have given President William Ruto and those of us in this administration support and unequivocal cooperation that could not have been possible without the right leadership at this Council of Governors. Let us appreciate our governors. So that coordination, I've been blessed to be part of that delivery by virtue of my work as chair of IBEC, which is the Intergovernmental Budget and Economic Council of the Republic of Kenya. And I'm again in that role, cabinet PSs in the various sectors, but also I have had the privilege of a very supportive Council of Governors who have made my work very easy. Again, let us applaud each one of us. So this coordination and cooperation has been very, very present. And the need for us to continue in that manner into the future is because if one part of the equation fails, then the patient will feel that failure immediately. A trained healthcare worker without medicine cannot treat. Modern equipment without personnel or maintenance cannot provide health services. Financing cannot improve health if the facility is not ready to deliver care. Therefore, colleagues, brothers and sisters, the health system performance is therefore not just the total sum of individual programs. It is the reliability of the complete patient journey. We need one healthcare system with the citizens at the center. I'll be speaking to this a little more in my summary because we need this health system must deliver to the people of Kenya. If we do everything else and the system is not serving the people, we will not have achieved the objective. County governments are central to the success of this reform agenda through the implementation of the universal health coverage, strengthening primary health care facilities, and they control the entire frontline implementation and service delivery, the CHPs and also all the facilities up to level 5. Ladies and gentlemen, distinguished guests, that journey should begin at the household and at the primary healthcare facility before illness becomes severe and expensive. The primary healthcare fund, as we were told by His Excellency the President yesterday, has received 27 billion shillings, has paid out 23 billion shillings to more than 9,300 level 2 and level 3 facilities. Unprecedented. Every time I travel out of town, every time I accompany the President out of town, they are telling us that the amount of funding that dispensaries, level 2, level 3 facilities are receiving has never been received. I went to a dispensary somewhere in Kericho, in Sigoit Soin, and the governor there, Eric Mutai, was with me. And the dispensary told us this week we have received 1.4 million shillings from SHA this week. And they say in the past we never even received anything above 100,000, 50,000 at most under NHIF. So that's where we are. And this is money, as we are going to see, that is going to be retained to improve service delivery. The financing, this financing has supported more than 20 million outpatient visits by 15 million Kenyans. We have also increased primary care networks from 2 in 2022 to 278 hubs spread across the country. The fund is functioning. The next question is whether every shilling improves the facility's readiness and the patient's outcome. We must measure medicine availability, waiting times, early diagnosis, maternal and child health outcomes, and completed referrals. Primary health care must become the dependable front door of our health system, close to the people, capable of resolving most health needs, and connected to higher levels of care when timely referral is necessary. In that connection, it is important to note that we are improving, or we have improved how we respond to emergencies through the SHA 922 Lifeline, and National Ambulance Dispatch Center, Kenya now has one national medical emergency number. One free call to this number connects a citizen to a trained dispatcher, an available ambulance, an appropriate facility and financing required for evacuation and the first 24 hours of emergency treatment. We must now make 922 dependable in every county so that we measure performance through calls that are timely answered, save lives, appropriate referrals, and lives saved. In an emergency, geography and household income must not determine who survives. The same delivery discipline must guide the National Equipment Service Program, NESP. NESP is strengthening diagnostic imaging, theater, renal, laboratory, and other specialized services in county health facilities. His Excellency, the President, gave us the statistics yesterday, what kind of equipment, the value, and the program is ongoing, and it's across the country. Again, unprecedented. But equipment delivery is not the same as a service delivered. Our concern must be whether the equipment is functioning, whether trained personnel and consumables are available, and whether patients are receiving timely services. More than 500,000 surgical procedures and over 50,000 cancer care services have been supported through SHIF, the Social Health Insurance Fund, and Emergency Chronic and Critical Illnesses Fund, ECCIF. We must now build complete pathways in which screening leads to early diagnosis. Diagnosis leads to treatment, and treatment includes appropriate follow-up and rehabilitation or for optimum health outcomes. Our ambition is not to own more machines. It is to shorten the distance, the time, and cost between a Kenyan and the care that can save their life. None of this is possible without health workers. Since 2022, again, we have deployed 24,000 healthcare interns across all 47 counties. We've sponsored 262 medical registrars for specialist training, and we have committed now to recruit additional 5,000 nurses and midwives. Internship must remain. And this workforce is now supporting the 107,000 CHPs that are on the front line. So you can see already the progress that we are covering on the issue of personnel and healthcare workers. Internship must remain predictable and properly supervised. But we must look beyond placement. National and county government needs one workforce plan connecting training, internship, recruitment, equitable deployment, career development, and retention. We must also train for the health system we are building, not the one we are leaving behind. That means stronger competencies for the future areas of healthcare service delivery, which include primary health care, oncology, surgery, anesthesia, emergency medicine, critical care, biomedical engineering, and digital health. A health system cannot perform consistently when its workforce is managed through periodic emergencies. Our health workers must be planned and supported as a strategic national asset. I repeat, again, commending the fantastic work under CS Duale and our team in health, the COG. We must continue to make sure there is stability within our healthcare workers. We cannot have useful and progressive delivery system if our healthcare workers are disrupted from work. So we must build on this progress, and we have no excuse, we have no reason, we have no justification to allow disruption of healthcare service delivery. I must commend also the leadership of the healthcare worker unions. They have been very reasonable, and you have supported both county governments and the national government to find win-win situations to avoid disruption of service delivery. For the avoidance of doubt, we, the government of Kenya, national government and county governments, treat you, our healthcare service providers, as a strategic national asset. Brothers and sisters, ladies and gentlemen, the second condition for reliable delivery is commodity security. KEMSA's order fill rate, as we heard yesterday, has increased from 40% to 91%. And we have supported as national government KEMSA with 1.5 billion shillings directly, and also provided support for them to access a line of credit to the tune of 10 billion shillings. The next stage is to build an end-to-end supply chain that anticipates shortages before facilities run out, has become one visible and accountable system. I was there when KEMSA and DHA were updating the president on where we are. And I think where we need to fine-tune now is the integration of the digitization process in KEMSA with the Digital Health Agency medical health data, so that it's one seamless. You cannot have a digitized supply chain data that is separated from mainstream healthcare data. So the two are interlinked. So we need the two systems to speak to each other. And the supply chain and commodity supply chain data to be part of the whole under DHA. In the longer term, Kenya must manufacture more of the medicines, diagnostic medical devices, and offer products that we consume. Local manufacturing will secure our supplies, create skilled jobs, support innovation, and convert health expenditure into domestic economic opportunity. The reforms are in place and the investments are being made. What is now required is disciplined coordination across national government, county governments, agencies of government, providers, training institutions, partners, including implementing partners. We should leave this session today with a compact set of performance measures: facility readiness, equipment uptime, medicine availability, workforce coverage, waiting times, referral completion, patient safety, and health outcomes. Digitizing gives us real-time visibility of health workforce, commodities, equipment, and referral pathways that enable timely correction and accountability wherever the system is off track. These measures should be visible by both the facilities and county governments. Strong performance should be recognized and shared. Persistent underperformance should trigger support, corrective action, and accountability. Our objective is straightforward: a health system that works the first time, works in every county, and works for every Kenyan. That is how we will move from policy pronouncement to programs, to performance, from investment to value, and from the promise of reform to reliable healthcare delivery. Thank you very much.